It is a treatment that is popular with professional athletes, mainly because of its quick healing and recovery time.
Now members of the public are turning to this medical procedure, which uses your own blood. Dr. Jay Adlersberg is here with details. Jay?
Shade, Diana, this is a fairly new procedure to treat chronic tendon injuries called tendinopathy. In the elbow, for example, a sore tendon can be very painful and interfere with daily activities. So some people are turning to a treatment which uses their own blood to heal the injury. For golf lovers, there's nothing better than a day on the links or on the asphalt if you're a tennis lover. But sports can leave their mark, especially after decades of the game. It happened to Karen Calcano in the form of an elbow injury.
It was quite painful, very stiff. It would swell. I had to stop playing the sports I was playing.
This is Karen's tendon, some abnormality where it attaches up here to the bone.
Karen had developed tendinosis. Inflammation is gone, but scarring and pain are left. Hillary Leff had a similar elbow problem from tennis. On this day, she's giving what doctors will use to treat her own blood.
Nobody has a reaction to it. It's their own system. And it's, in simplistic terms, it's great. I mean, use your own stuff, so to speak, to help you heal yourself. I mean, how great is that?
What the blood has naturally are chemicals called growth factors, which promote healing. That blood is put into a centrifuge to separate out the platelets or clotting cells. It is these platelets injected back into the injured area that will release a concentration of growth factors, the chemicals that naturally heal.
We kind of supercharge that area with a higher concentration of the patient's own growth factors, platelets, which release these growth factors, to try to reconstitute a tendon.
There are only a couple of very small studies of the procedure, but Dr. Halpern says that some 80 to 90% of patients heal partially or completely. He's injected about 60 patients already for tendinopathy problems in the foot and ankle, knee and shoulder.
There's a lot of promise for this, and applying it to the right patients doesn't fit everybody. It's not a panacea. But it seems to be very effective.
The whole concept of letting your body use its own natural healing agents was very appealing to me.
Some patients may require more than one treatment for good healing. Dr. Halpern told us, as best he knew, insurance companies know nothing about the method and therefore are not paying for it. However, Karen said her insurance company covered it partly. It may take a larger study to prove the effectiveness of the technique.
Okay.
Thank you, Jay.
Thank you, Jay.